Greetings, this is Advocates Global News for 2/23/2020, and again today we're focusing on the COVID-19 coronavirus update. What are the new numbers and what do they tell us? So this is Baidu. Baidu is a Chinese search engine that has a site set up that's relative to this coronavirus outbreak, and it's a pretty long page. You can scroll down and get all kinds of information from here. So this is Baidu, and I'll have a link in the YouTube description below. So I've spent some time explaining these numbers in the past, and I don't feel a need to do that every day. So really quick. First of all, if you go to this page and look at it, it's really rare to see this yesterday numbers. That's a delta from the day before. So like yesterday, we're down 1,584 new confirmed cases from yesterday, and suspected cases were up 620. Now China is 12 time zones away from the United States Eastern time zone, and what they do is they publish these delta numbers late in the day, and then they reset them to zero again because it's a delta number. It's going to start at zero every day. So you don't see those very often, but 2 days in a row I happened to snag this where I saw the numbers. So really quickly, confirmed diagnosis, what this is confirmed by a blood test, and the blood test is using a microscope. So normally, they actually, were doing all their microscope work, and they were actually looking for a virus. Okay, and a virus is, I did a study once on viruses, and they're really small. You can get, zillions of these on one human cell. That's how small it is. So, you have to have a scanning electron microscope or a microscope the size of a, Mack truck. And it has to say something like Nikon on the side or some other imaging company's name. So anyways, that's what confirmed diagnosis is. Cumulative means that includes the confirmed plus other diagnostic tests. Now there's a few different tests that they use, and it's not really important to list all those tests, but there's another blood test. There's CT scans where they can look for damage, to tissue and tell it's coronavirus. But there's a multitude of other tests that you can do with blood without actually looking under a microscope to see, an actual virus. Then there's suspected cases. That's up 620, 34. That's down, drastically from, a couple weeks ago. All these numbers are down. Well, not except for the cumulative diagnosis. We're at 77,000 people now. Cumulative cure, that's really deceptive because these people weren't cured. Of these 24,811, probably 24,000 or 23,000 weren't cured. They just overcame the virus, because the mortality rate on this virus is only 2.5%. Most people, if they get coronavirus, they're just going to have cold symptoms, and they'll be okay in a couple days. That's what happens to most people. And then existing severe means ICU unit. So people are in the ICU either from a really bad case of pneumonia, or their lungs are all filled with fluid, or maybe their heart is struggling, really weak heartbeat because of the virus taking over organs. And then cumulative death is at 2,595 deaths, up 150 from yesterday, and that's a little high. Usually it's from, up like 90 deaths every day up to 120s, 150s. A little high, but we've seen that before, so that's not shocking. Then what I do is I take a look at the day before to get the deltas, but the deltas are listed for us here. So if these numbers weren't here, I would just look at the day before, and then you would. Now, the day before plus the current day's delta seldom gives you the big number, because of the timing where they reset that delta to zero. But anyways, if you see, normally you would look at this page and you would see 6 numbers and you wouldn't see those delta numbers, and there would be a sentence below saying that the changes from yesterday are not going to be published until the Chinese Health Commission takes a look at the numbers. In other words, they're communists and they have to approve everything. Then next you see, if you scroll down underneath that chart that we saw, you see a map of China, and this hasn't really changed in a long time. The redder provinces in China, basically you have 2 levels now, 10 to 99 cases and 100 to 999, and then Hubei province in the middle, which is white, should be that really, really dark red color, but if they made that really dark red, the name of the province is also in red, and you wouldn't be able to see what it is, so they just whited that out. But that's the epicenter where everything's happening. And also on the right here, China shows every day the South China Sea and all those islands that China owns, China thinks they own. Because China was a seafaring country like England and Spain and Portugal and the Netherlands, or whatever they were called back then, the Dutch. The famous European explorers that went all over the New World and all over China, all over East Asia. China was not a seafaring country, and they have no claim to these islands, but they include them in there on their map every day. Now, if you scroll down a little bit further, you see 2 graphs. This graph is a day behind, and I just snagged this not long ago. It's already the 24th in China, and we're missing the 22nd. So tomorrow we'll see 2 numbers fill in there. But so there's no point in talking about these. I discussed them in the previous video. Same numbers that we saw yesterday. Same with this graph. Now, what these graphs do, this one here, this says, the gold number is non-Hubei province. The pink number is Hubei province, and then the red one is all of China. So you can see that, Hubei is almost the same graph as China, because that's the epicenter. That's where everything's happening. That's where all the initial people were sick, and even though they locked down the city, and even though a lot of people got out of the city, there's still so many more confirmed cases in Hubei that it influences China, almost the same graph. Then I went over these numbers yesterday in Henan province. There's 19 deaths, and there's 12 in Heilongjiang, which is where Harbin is. So this is alarming here to see these number of deaths, because outside of Hubei province with 2,346 deaths, most provinces only have 1 or 2 or 3 deaths, and we're way up at the top of the chart, so you see a couple 6s in here, but a 12 and a 19 is not common. So the 19 you see in Henan, a lot of that is due to prisons. Prisons just weren't ready for this virus, and a lot of prisoners got infected from people visiting and from maybe the staff, the guards, and the working staff. And the other province where Harbin is, that's due to Harbin has the world's largest ice festival every year that starts in mid-December, and it runs through the end of January. And it was shut down early this year because why? Because there's, the government, the central government came out and said no public gatherings. We've got a really big virus problem. We're canceling Chinese New Year, and we're certainly going to cancel the ice festival. Then if you scroll down further, you see some topics of the day. These are actually search terms, and the number one every day is people going in here looking for the numbers that we just looked at. So that's what they want to do. They want to see how many deaths there are, how many new cases there are. So this is Chinese people searching for, the numbers that we just looked at. And then you have other stories, this astronomical leader. I wondered what the heck that was, and I looked it up, and this guy's an astronomer. He's 92 years old, and he's got coronavirus. And then we have, something that really looked funky to me. Persons stranded outside Han can leave the city. That Han should be Hunan. And we'll take a look at that in a minute. And then the number 8 one down there. These are search terms, so they don't always make sense. But they're all related to the same story. But, you're seeing extra terms in here that's a little confusing. So any city jail isolated on the flight. I don't know what that means, so I had to look it up. So the stories we have today, the astronomer, which I didn't do a screen capture of, he's just a really old guy. So Wuhan announces some people can go out of the city. Notice is invalid. Okay, that was a rumor, but people looked for it anyway. Somehow a rumor got spread around China, on social media that people from Wuhan can go outside the city. Well, no, they can't. People from Wuhan infected the whole world. We're not going to let them outside of Wuhan. So this is what a road looks like. All the airports are shut down, the train stations are shut down, and all the roads look like this. So nobody's going anywhere in Wuhan. And that other crazy topic, I couldn't figure out what it was. It's a guy in a prison that refused to be isolated. I think that means solitary confinement. So he escaped that prison, and he was an escapee for about a day, and then China got him. So probably sucks to be him right now. Then the other thing I look at every day is this Johns Hopkins. This is a research institute that's tracking this, and Baidu is China, and this Johns Hopkins is global. It's everywhere else, including China. So this is a research institute. I actually worked at a Johns Hopkins Research Institute for a while, and I don't know if this one's affiliated with Johns Hopkins University or the hospital, but there's a lot of research institutes in every university in the country. So they've been doing a good job of this. This thing has changed a lot since day one. They added those 2 columns on the right. The graph is new, and just a lot of things are new. So I take a look at this every day, and I'll show you what I do with this. So the first thing I do is compare it with China's numbers. Now China shows on this day 77,262 total cases, and we see 77,150. So we're shy some cases there. So if you add those to the total confirmed, you get a more realistic picture of what's happening. But today, the difference isn't that much. Sometimes it's, several hundred. It's usually several hundred. So that's the first thing I look at, is just to see whether the big number is correct or not. Then I start taking a look at some of these crazy numbers below that. So these are scroll bars, as are the numbers on the right for total deaths and total recoveries. See, we use recovery instead of, healed, instead of whatever they used that conveys the thought that they were cured. Oh yeah, they use cured. So what's alarming here is 3 things right away. South Korea, 833 cases, 215 in Italy, and 61 in Iran. Now these are all new countries at the top of the list. So naturally that's alarming. I've been following this for a long time, and it's usually, it usually goes China, Singapore, Hong Kong, Thailand. US is usually way down the list, and so Malaysia, all those countries are increasing from Thailand down. But, we see new countries on this list. So naturally, I want to take a look at that. So what I did was I searched, and usually I have to search all over the web for each one of these countries. But today, Fox News has all 3 of these covered. And these are the 3 most alarming things going on in coronavirus land outside of China. So Fox News says, and there's a big jump in Italy, South Korea, and Iran. So let's take a look at their story. So they're starting with Iran. I have a little yellow arrow by Iran. A staggering 50 people have died in the Iranian city of Qom. I don't know. Probably not saying that right. From the new coronavirus this month. Now 50. I just showed how alarmed I was by 19 and 12 people dying outside of Wuhan province, because that's really high for any other province outside of Wuhan in China. And we got 50 people dying in Iran this month. So that's craziness. And it said they were at 12 deaths and 47 cases just, when was that? It stood at 12. A few hours earlier is what they said. So from 47 to 61, and even that is low now. But 50 deaths, that's crazy. That's just crazy, crazy. Then Italy. Italy was at 20 yesterday, and now they're at 215. And Italy is considered Europe's first major outbreak and largest outside of Asia. The number of infected jumped to 152 from 10 days ago. Well, now it's up from 152 to 215. So we have 110 cases in Milan now. These initial cases that I think the 152, those are northern Italian provinces. So I don't know whether people from Wuhan said, hey, let's go skiing, because they're up by the Alps. There are no big cities up there. They're just basically villages where it started. But people from all over Italy go to the Alps to go skiing, and that's probably how it started. People from Wuhan went to northern Italy, infected little villages there, and now we've got people in Milan and Venice infected too. So Italy is basically going on lockdown like China. Canceled soccer matches, and movie theaters are being shut down. So Italy's starting to take drastic moves now, but they're already in the few hundreds. It's over 215. It's in the 300s now. Then we have South Korea, which is the craziest place. So cases in South Korea increased to 763 on Monday. Well, now it's 833, and you can see from yesterday it was 433. So it went up 400 cases in one day, and that's just crazy. And this all came from there's one woman, a 61-year-old woman, who's a super spreader here, and that woman has never been to China. She claims, like crazy, she's never been to China. But she's in this religious cult, a Christian religious cult, a big, huge group of people with thousands of people in it. And what happened, the people from the city, Daegu is the name of the city, a city of 2.5 million people, and it's in southeastern South Korea, and it's inland, like Seoul. Seoul is in the opposite corner of the country, the northwestern part of the country. But it's strange to have this outbreak going on there, and it's all due to this religious group. So they had some kind of religious service where there were 1,000 people in a building, and this woman went there when she was infected. And then all of a sudden now we're having hundreds of people infected, and then they go to hospitals and they get doctors and nurses infected because why? Because normally in a hospital, like in the United States now, or Canada, or most countries in the world, you go into a hospital, you don't see people in hazmat suits. Nobody's wearing virus suits, with goggles and masks on, because there's no reason to be alarmed. So that's what happened in South Korea. People started going into hospitals, then they started dying, and now they're starting to confirm all these coronavirus cases. So that's what's going on with these three countries. South Korea, Italy, and Iran are just setting new records for doing for coronavirus. Then outside of that, we have 691 people here in others. Now what's others? Others is a cruise ship. And it was 634 yesterday. So I don't understand how the cruise ship is going up. They should have been done testing everybody a long time ago. They could have been waiting on results, but that number should be going down drastically. And why is that? Because people are, like the United States, you see an airplane here, and this is, the Diamond Princess passengers, flight from hell, they saw coronavirus class. So this is a big, transport airplane, like I don't know what it is, like a C-5 or something like that. But it's a huge military transport airplane that's been converted into, a coronavirus airplane. And, that's how we got people out of Wuhan on this airplane. And now you can see everybody's wearing a mask on the plane, and it's got a little tent there. Those are probably infected people inside that tent. And inside there, they would all be in those little pods. So, it's crazy. We repatriated a lot of people, and so did Japan. So the number of confirmed cases on that cruise ship should be going down, not up. Oh, and also Australia repatriated people last weekend, and that number is not in there either. But, everybody's going to be taking their citizens off of this cruise ship, and Japan naturally would have a good hunk of them. They went from 119 to 147. But I don't understand how the total number on that cruise ship keeps going up when people are getting off the cruise ship and going back to their country. Then these graphs, this is yesterday's graph, which I was going to use for today, but then at the last second, they finally published a new graph. And this new graph even is missing some numbers. We have February 22 in there, 23, 24, but the 24th number is not in yet. And I just take a look at this graph. I've been doing this, since the beginning of January, where I put in these little red lines to see what the trends are over a period of a few days, because the graph has some sections in it that are, where days are doing the same type thing. So we started out with a pretty linear increase, and then it started going up, accelerating with more cases every day, and that's where around February 4th, I think we had like over 4,000 new cases in one day, and then we have like maybe 3,500. So that whole stretch there is like over 3,000 new cases every day. So that was a pretty steep line if you bunch all those numbers together. Then we had 2 days of aberrations because of the difference in reporting, from blood tests only to other diagnostic tests. And then after those two, I didn't graph those 2 days because they're crazy. One day was Wuhan doing it, and that other number that's way up there for February, probably 14th or 15th. I think that's other provinces following suit with Wuhan. And then we had a kind of linear graph again, like at the beginning, and it looks like almost the same slope as the beginning, and then it started tapering off again. But I circled that in yellow because that should be a big spike that we see up there, but as we saw in the previous slide, the previous photos with the news stories, those numbers are way behind what we're reporting now out of Iran and Italy and South Korea. And that's all we have for today. Thank you.